You're listening to the Applied Natural Medicine podcast, showing how the science of naturopathic, integrative, and functional medicine is applied by clinicians in real-world practice. This is a production of NDNR, publishers of the Journal of Applied Natural Medicine since 2005.
Hello, everyone. I'd like to welcome you to the Naturopathic Doctor News and Reviews Applied Naturopathic Medicine Roundtable. I'm your host, Dr. Kareem Kandil. Here at the Applied Naturopathic Medicine Roundtable, we present clinical cases from practicing naturopathic doctors, cases that illustrate the application of naturopathic medicine in real-world patient care. And as Naturopathic Doctor News and Review marks 20 years in publication, we are grateful to Activation Products for supporting this milestone. Again, I'd like to also remind everyone that through the NDNR.com, you have access to this content from which you have access to continuing education credits. Now, today's topic comes from our July edition looking at musculoskeletal pain conditions, but this was a very interesting clinical case on the integrative management of multiple sclerosis and bilateral uveitis, a case study. And our guest contributor today is Dr. Heidi Wenhold, who received her bachelor's degree in biology from Washington and Jefferson College, and then received her doctorate in naturopathic medicine from Sonoran University of Health Sciences in Tempe, Arizona. She received the 2017 Physician of the Year Award from the Pennsylvania Association of Naturopathic Physicians and has a private practice located in Canonsburg, Pennsylvania. She specializes in natural modalities to manage autoimmune conditions and to help relieve stress and anxiety. Dr. Heidi Wenhold, welcome to today's roundtable discussion.
Thank you. Thank you for having me. It's an honor because NDNR is my favorite publication.
It is. It's a wonderful publication. It's what pulled me into the profession for sure. So again, this case, this young woman with multiple sclerosis, optic nerve inflammation, and recurrent uveitis, finding remission through homeopathy, dietary changes, and some neuroregenerative support. Let's jump right into this case. Tell us a bit about this patient, her background, and when you saw her.
She was lovely. She reminded me of a little pixie. She lives in West Virginia, and she traveled to come see me because she was having vision problems. And this was particularly discerning because she was studying to be a pilot and get her pilot's license. And she was currently a flight attendant and having issues. And then I started her on a very basic naturopathic protocol. And really within a month, she had another flare up, a lot of stress. Being a flight attendant nowadays, so many crazy things. So she did have a flare and she was admitted into the hospital and they were looking at it, but part of what contributed to it was her prescription was off as well. They ended up giving her.
How was it off?
I think really when they had looked at her eyes, her one eye specialist, it was just, he diagnosed it incorrectly. So she got a new prescription, but really it was her eyes were really flared from her MS. And uveitis, one of the side effects of uveitis or complications of it, I should say, is vision loss. So it was really important to jump on that quickly. So they were giving her IV steroids in the hospital and then increasing her topical drops, corticosteroid drops, eye drops, to 4 times a day when she left. So she came in and we were thinking about what are some things that we can do to help get this inflammation down. So we incorporated some homeopathy. And I think that's when things really started to turn around for her, was these homeopathics.
And I know you mentioned some basic naturopathic care, and there were definitely some good kind of foundational aspects of this kind of gluten-free and dairy-free diet, which again, I think so that's coming from naturopathic doctors. It may seem like that's a trope, but I think especially in the case of any sort of neuroinflammatory type of condition, especially like MS, or if you're dealing with some of this autism spectrum stuff, it becomes especially important to avoid some of these kind of key triggers to some of the autoimmune reactivity that can take place between some of these proteins that are present in casein or in gluten as well.
I completely agree. If you look at Dr. David Perlmutter's information, like gluten, the grain brain, and boy, I see that so much with MS and other autoimmune diseases. I have another colleague that's an integrative rheumatologist, and she says the same thing. We both prescribe the Mediterranean type diet. And for her, she notices it's a big difference. It decreases the amount of medication or the intensity of the medications. For me, boy, the vitamins, herbs, homeopathy work better because there's this philosophy in naturopathic medicine about removing obstacles to cure.
Absolutely.
And everything works better when you remove that what you're sensitive to. And gluten is definitely a big issue. And boy, it's documented in the literature that with MS, and there's a higher incidence of food allergies related to MS and worsening their symptoms, worsening the progression of the disease. But also, even looking at our colleagues like in Portland and Heather Zwickie's work, she did that with Parkinson's, looking at dairy and how dairy intake decreases something called serum uric acid, which is protective in the brain. And she saw like a decrease in progression of Parkinson's when people cut out the dairy. But I find that too with MS, it really helps because you look at the Swank diet, that the Dr. Swank did a lot of research about too much saturated fatty acid. Saturated fats promote inflammation, and that progresses disease. And there's a lot of saturated fat in cheese and dairy, and that worsens MS progression. In casein itself, you mentioned it, it's just a really pro-inflammatory protein. And I feel this way, and you probably too, but inflammation progresses disease. And I don't care what disease it is, but inflammation, when it's uncontrolled, it makes it worse.
And I think it's worth discussing when we're talking about the dairy and gluten that have definitely been part of the human diet for millennia, that when making these recommendations isn't inherently an attack on that food. It's recognizing that people with these disease states have a higher sensitivity. There is a strong kind of established cross-reactivity, particularly with some of the types of these proteins that persist more in the diet, maybe versus some of the heritage varieties that were more common ancestrally speaking. And that definitely, like you said, this aspect of kind of being an obstacle to cure. It's like we can always throw a lot of great kind of modalities, from the simplest minerals and amino acids and vitamins to targeted botanicals and even pharmaceuticals. But if we have something that continues to pour that fuel on the fire, that continues to drive the inflammation without putting a causality or blame on that food or whatever, but just recognizing the reality that for that patient, that's simply going to be something that gets in the way of cure. And whether or not down the road at some point you're willing to be like, okay, this is where I'm willing to accept this trade-off in my consumption and my disease symptoms. But definitely when you're trying to nip something in the bud, when you're dealing with an aggressive type of disease like that, it is important to have respect for the body. And like you said, remove that particular obstacle to the cure for you as that individual patient.
Absolutely.
We talked about some of the foundational stuff, also trying to address some of the neuroinflammation with her getting some of the curcumin, the fish oil, NAC to definitely help support both the antioxidant support, mitochondrial health. But let's jump into the homeopathy, since this is definitely an area that a lot of our clinicians, I feel, may sometimes have some trouble with, oftentimes because, again, just like within naturopathic doctors, we have various flavors of our doctors that tend to gravitate towards their modalities of choice. Even within the homeopathic subcommunity, there are differences in approaches to homeopathy. Many of us, I think, were trained in a very classical Hahnemannian homeopathy. You find the right remedy, you give it, and you get this permanent cure resolution, as Hahnemann described. But I think a lot of modern naturopathic doctors and homeopaths that use this find that sometimes the reality of our situation dictates a little bit more than that. So tell us about what you started her with and your dosing approach with her when it came to homeopathy.
Sure. I'm passionate about homeopathy because that's really the main reason why I entered naturopathic school. At a young age, I always wanted to become a doctor, but then my mother took me to see a homeopath for my allergies and my eczema, and I was told that I would need to be on steroids for the rest of my life. And it was my mother that thought, no, 12 years old, we need to find another way. And she took me to see a naturopath who prescribed homeopathy, and all my allergies cleared up. And so I became a believer, and I thought, oh, I'm going to go to medical school and I'm going to learn homeopathy and combine it. But then when I learned about naturopathy and that you learned all these beautiful modalities in school, it really inspired me. And that's really why I became an ND. And I was fortunate. I had Dr. Mittman in school. He taught me homeopathy at Southwest and college, which is now Sonoran. But then afterwards, I did additional training with Dr. Ramakrishnan, who is a well-known Indian homeopath. And I loved his approach. And he said something that just stayed with me. And he said, as the intensity of the case, so should be your repetition. Be bold enough to repeat that prescription. And I've seen that just make all the difference, especially with autoimmune diseases. And MS is an autoimmune. And we talk about homeopathy, and yet it's this microdose. It's this idea, and that's what's so popular right now. In the medical field, the new thing right now with MS is this microdose of things, and really that's homeopathy. It's taking a plant or a mineral and diluting it to such a minute amount. And it's not unlike that sublingual immunotherapy or this concept of an allergy shot where you're given something very similar that you're sensitive to in a high dose, but in a low dose, it just helps to gently get the body back into balance, helps modulate the immune system. And that's what we want with autoimmune and neurodegenerative diseases, get it back to regulating itself because there's so much dysregulation.
Yeah, absolutely. That line that you put in there about Dr. Ramakrishnan, about being bold enough to use the indicated homeopathic medicine more frequently, and that deep-seated pathology requires more repetition. I think that's something that may not always be as emphasized in the training that naturopathic doctors receive with homeopathy. It really just depends on their exposure. And so it's really fortunate you got that. And like you mentioned, again, with more severe conditions, even when it comes to basic nutrient dosing, we may find that if somebody is more acutely ill, that the dosing for a vitamin, a mineral, an antioxidant may be several magnitudes higher than what is traditionally given and dosed to someone with a milder condition or for a kind of general health. Likewise, it would make sense that you have a more severe, deeply rooted condition, an autoimmune type of condition, that, like you said, it can take a little bit to peeling back these layers. And so there is absolutely sound reasoning behind repeating the homeopathic dosing. And again, since we're dealing with very minute amounts of these substances, we're working on this nano pharmacological microdosing potential that allows us to avoid some of these issues. And of course, it's very interesting, the first remedy you talked about use here is Conium, poison hemlock, the one that, is classically associated with Socrates' demise. And of course, the whole feeling of, okay, the loss of the sensation going up his legs and that sort of keynote. So tell us a little bit about it, because it's a remedy that I've had with one of my cancer patients previously that she had been put on for some of the neuropathy she had. So very interested to hear your sort of approach to using Conium with this patient.
That would be a good pick for a cancer patient. I can totally see the reasoning with that. The ascending paralysis, it is a keynote for that remedy. But in this case, we really selected it because it's also good for eye issues and vertigo or eye issues or pain in the eye, or turning the head, having vision issues. So that was the primary reason we selected that homeopathic medicine. But I ended up combining it too with another homeopathic called Natrium sulph, which is a combination remedy of natmir and sulfur. It's interesting. I find natmir to be a really good remedy. Also, Conium too has an affinity to the nerve cell, as does Natrium muriaticum. And I use that a lot. That comes up a lot in autoimmune cases. But this combination of nat sulph, particularly because she had so many incidences of concussion. She was in so many accidents. She was from West Virginia. They're riding their quads, four-wheelers, was in a wreck, and she was ejected out of the quad and hit her head. The policeman on scene thought she was dead. It was really severe. And really, with this, just the multiple hits, and she was raised by a woman she had a bipolar mother. There was a lot of stress in the family. And she had a little bit of anxiety, depression, and really Natrium sulph and homeopathy and the Materia Medica, we call it one of the king of the depression remedies.
Mm.
That along with Arum, really good for depression. And
Mm-hmm.
so that helped. It was interesting because it was almost like she described it almost like turning on a light.
Mm-hmm.
She felt it instantly when her vision would get really blurry. If she would, especially when she was under stress, when she would take Natrium sulph, it would start to clear. And at some point too, I also gave a homeopathic medicine called Staphysagria, which is a very popular remedy for suppressed anger, for very sweet people that overextend themselves to others. And I did interject that remedy at a couple times because too often we ignore this with autoimmune. And it's well documented in the literature where there's such a focus on keeping inflammation down, which is important. But there's also this mental emotional component where it's documented where 80% of all autoimmune, they had a prior, like very traumatic trigger. And this individual had multiple. And that's part of the healing. And it's looking at the person as a whole. So we're looking at them, they're mentally, physically, emotionally, spiritually. This was just a really good match. And I think that's why she had such a good response.
You make a very profound note. And I remember, I think it was one of Dr. Moshe's blocks book talking about holistic counseling. That's when I first came across the concept of this connection of emotional trauma and autoimmune disease and attacking of the self. Literally, that's essentially what the immune system is doing. And once I came across that connection, I could never unsee it. And it just became, with every autoimmune type case, you're like, okay, where's the trauma? Where's the self? You see the pattern. Oftentimes, again, oftentimes, like you said, like this Staphysagria type picture, the sweet person who overextends himself, that kind of suppresses the anger, that there are some people who have a pathological expression of anger too much. And then you have other people who feel like it must be better to turn this anger inwards against myself. And then it's safer. And we don't realize how that can actually trigger and drive some of that disease process and how it can become very important to help release some of those emotions that are associated with it. Because she had this combination of physical trauma, these physical accidents, this kind of concussion and post-concussion type syndrome that is going to definitely cause a degree of neuroinflammation. And then you have the emotional kind of stresses as well, and that gets internalized. Yeah, absolutely. It makes sense that we can see this kind of expression now in which that nervous system is now being literally attacked by your body's own host defenses.
Absolutely. I think almost at some point in this life, almost everybody needs a dose of staph. In this world, we're swallowing a lot. And it just, every once in a while, it helps to just release that, even as a preventative.
It's kind of been a while, but sometimes you got to be careful. I remember I dosed a fellow colleague in clinic when they were pretty stressed and it needed an outlet at a certain point. But no, it's fascinating again how some of these like very common kind of polychrus remedies, the nat sulph with kind of like this sort of emotional exhaustion type of picture with from the nat your side, and then again the Staphysagria, the suppressed anger, the Conium with definitely both the visual and this kind of nervous system association. Very, again, which again speaks to the levels of what we're seeing in terms of disease complexity in this day and age.
Complicated.
Yeah, I mean, our world's more complicated. The world that doctors like Hahnemann and Benedict Lust grew in, like they definitely saw, okay, there was industrialization, some of this pollutions, but we have new levels of nano and micro polychemical assaults that we have no idea what it's doing. And onto that, we add the effects of various non-ionizing or non-native EMFs that are also impacting our nervous system. And I know you we were briefly discussing beforehand, you'd mentioned that Hahnemann had talked about the situations like in these like epidemics or outbreaks, this kind of need sometimes for like combining remedies. So I'd like to hear your thoughts on that.
Sure. I'm giving a lecture to the New York Naturopathic Association in October, and I'm giving a joint presentation, and it's with another MD. I'm talking about this case, but he's also speaking about cancer-related fatigue, and his name is Dr. Freed. And we had this conversation. I thought this was so interesting because he's doing a lot of research in the hospital about cancer-related fatigue and in the Israel hospital. And what he found was he considers himself a classical Hahnemannian homeopath. He was trained by Vitholcus in Greece. He went through his trainings for 4 years. And what he found was that incorporating homeopathics in a cancer hospital, that he saw improvement in their fatigue. But then after a while, he started combining the remedies. So instead of just giving one twice a day, he would give 2 remedies twice a day. And he would see increased improvement. Then he tried it with the 3 different remedies, and then 4. And it led to this one combination remedy of 5 different homeopathics. But he sees cancer-related fatigue as one remedy for one disease. And he was quoting Hahnemann in the Organon. It was like paragraph 3 of the most recent edition. But Hahnemann himself would study the epidemics, and he would actually customize the remedy to the epidemic, and he would combine several different remedies. So we get really hung up on this, okay, you can just give one remedy at a time, or you give it once and then you don't repeat it for a month. For the reasons you explained, that just doesn't hold up anymore. We are living in a toxic world. We've been exposed to more pesticides, and some of the things that you explained earlier, even about these nutrients, like why we might need higher doses, the soil's depleted. There's just, when people are in an inflamed state, they need more. They need a therapeutic dose. They just don't need a regular dose. It's increased. But same thing with homeopathy. When you talk about that obstacles to cure, we're also completely exposed to things we don't even realize. In our water, our plastics, and our air, everything is just
in our emotions too. It's like it was natural people would experience a certain level of emotional traumas that were like, okay, this plague is coming through this. We're getting like all of it from everywhere, all at once, all the time.
And global
And it's a
warming.
never-ending stream,
No. And even the stress of our environment. I can't remember. I live in Pittsburgh, and I can't remember a hotter summer. And then you're combining it with these intense flooding. In West Virginia, close by, several people died not that long ago. Just these intense floods. This is a different world. And we
Yes,
need to practice differently. We have to adapt. We have to change.
100%.
Yeah.
100%. And one thing is, I appreciate the fact that you found this in Hahnemann's Organon. And I think the beautiful thing about Hahnemann is, even if you're not a quote unquote a homeopath, the advice he gives is universal applicable advice, like giving the minimum effective dose. The fact is, when we see some of the adverse effects or things going wrong in a number of kind of some of the innovative aspects of medicine, whether it's cannabinoid medicine or psychedelic medicine, part of the problem is oftentimes when you're giving too much to start. And so it's like there is this approach in which you go with the lowest effective dose, and if you need to increase, you increase. But that way you aren't giving more than what's needed, and now the body has to deal with another problem on top of the original problem. And this concept of synergy we see, for example, in cannabinoid medicine, talk about the entourage effect. We don't just want to give massive doses of THC that can cause problems, but if we give low doses of THC with a little bit of CBD, some other minor cannabinoids and terpenes, we can find this better kind of clinical efficacy at lower doses. The same thing with a lot of different nutrients. Rather than just mega dosing just B1, you give good doses of B1, B2, 3, 12, 9. All of a sudden you have a better overall kind of entourage effect. And so it would only make sense that in the cases of these kind of more complex issues, these kind of complex root causes to these complex diseases, that to cover some of those key notes from a comprehensive perspective, it may take a few different remedies in order to do that, in order to get the best overall results. So I think that it's very possible to truly honor the legacy, of these clinicians of the past, and being aware of and cognizant and responding to the realities and challenges of our age when it comes to practicing this medicine. And of course, again, adding additional frequency of homeopathic dosing is probably one of the easiest, safest, non-conflicting interventional approaches that one can use. You may not always have that liberty of macro dosing certain nutrients if a patient may have a sensitivity to it, or certain fillers or whatnot. And again, that's an issue that's easily avoided with the use of homeopathy that can help to harmonize the other therapies as well.
I totally agree. I believe in that do no harm. And I love that idea that you talked about with synergy, because I believe that. And I believe that all these things work better together. You can use them in lower dosages, even the herbs, botanicals. I don't use a whopping high dose of curcumin, but still I'm getting a good effect. But I think it's because I'm using it with all these other things.
Yep, the fish oil, the phosphorine, it's
together. Then you don't have to worry so much about side effects of one particular plant or thing that you give. And then the other pearl I'm going to throw out at you is NAC. You mentioned it's a good antioxidant, but I came across a really cool study where it showed that NAC increased vitamin D levels, regardless if the person was supplementing with vitamin D or exposed to additional sunlight. So I thought that was kind of cool.
NAC is really a fascinating amino acid. I remember coming across, obviously, again, in conventional medicine, it tends to be thought of as we reserve this for Tylenol overdose and cystic fibrosis. And it's really a shame, because everything from influenza to other types of viral infections, research even in psychiatry, helping with drug withdrawals, higher doses for supporting patients with schizophrenia. And when you think about NAC's key role, especially with replenishing glutathione, like the body's main antioxidant, and the importance of having that right balance and flux of these precursors and finished products, that because of, again, just the level of general assault our bodies are going through, just simply supporting that kind of foundational antioxidant status can help offer symptomatic relief in a variety of different conditions. And again, that's something that, unless you tend to eat a lot of cysteine-rich foods, people may not be getting enough of this precursor. So,
sure.
I know you'd, in addition to some of like the fish oil, NAC, we talked a little bit about phosphatidylserine, which is a very important phospholipid that's part of the cell membranes, and especially a part of the nerve membranes. And this is where we tend to oftentimes have deficiencies and attacks in the case of MS in terms of the overall cellular integrity and integrity of the myelin, but also has a beneficial kind of calming effect for the nervous system, and helps support that parasympathetic tone that's necessary for kind of healing, and just getting that nervous system to just be like, okay, we can rest, we can digest, we can heal. We don't have to be in this sort of stuck, fixed, sympathetic state that many of us are oftentimes activated into.
Absolutely. And phosphatidylserine also helps with word recall. So for the students out there that are studying for their exams, taking a little extra phosphatidylserine is like a good pearl right before midterms and finals.
Oh, no, I've definitely incorporated phosphatidylserine into my rotations with all the various other nootropics. I think a lot of people in this field, because it's like we have so much to learn and be responsible for, we're always, okay, what could give me that little bit of an edge? And speaking of, I know you also had them on lion's mane mushroom, which is a very fascinating mushroom. Even you look at its physical characteristic, it looks like all these little dendrites coming off of this little cell mass. That doctrine of signatures for nerve cells.
Isn't that the truth? It increases something called brain-derived neurotrophin factor. So BDNF is just a fancy way of saying anything that increases BDNF is going to help increase and repair neuronal cells. That's what we want, because with MS, there's lesions, and where there's just a depletion of myelin in certain areas. It can be in the brain, it can be on the spinal cord. And we're removing obstacles to cure, we're decreasing inflammation, but then we're also providing things to the body to help heal and regenerate. And
Hmm.
that's what we want. And things that have been shown to pass that blood-brain barrier, BDNF, an increased BDNF is lion's mane, but also curcumin. There's
Hmm.
multiple studies with curcumin. Skullcap is an herb that also passes, and NAC. So that's the reasoning behind incorporating all those.
Yeah, and I love the way that you incorporated the use of the scutellaria, the skull cap in the evening to help with unwinding, along with kind of magnesium glycinate. Again, that glycinated, chelated form that's more calming to the nervous system. And so it creates this good kind of synergy and like approach to, the patient that's, again, more in harmony with their biorhythms. So again, it's really nice how all these different things layer very well with each other, not in a conflicting way, but again, in that sort of synergistic fashion, that sort of entourage effect of these different compounds supporting each other in both absorption and overall effects to bring the body towards healing.
Skullcap has become one of my favorite herbs. It just kicks in within 20 minutes and it really does. It helps calm you down. It's also good for tremors. I found that
Mm,
really helpful, even with Parkinson's patients. If they get an exacerbation or under stress, their tremors are worse. This helps calm it down. You're calming down their anxiety, which is also increased with the Parkinson's, but yet the anxiety makes Parkinson's symptoms worse. So it's just another pearl to throw in.
absolutely. So it seemed that you put the patient on this regimen, and tell us a little bit about the prognosis of her case. Obviously there was a point where she had to be on IV steroids for a while. She was doing steroid eye drops 4 times a day. You got her on the homeopathy. We made the lifestyle changes to prevent the obstacles, in emphasizing the importance of avoiding the triggers of gluten and dairy in her case, which you had mentioned that she started to notice. Yeah, I do notice I have the weed. I get a little bit more foggy and bloated like a nice loaf of bread. I think we all tend to do
Absolutely.
that with gluten. I mean, there's no denying its deliciousness, but it's not going to manifest the best when it comes to neurological and mental health in these situations. But yeah, tell us how she ended up doing after all these interventions you used with her.
She did need that IV steroid in the beginning because you had to get that inflammation down quick.
Mm-hmm.
Because this was threatening her, where the lesion was on her retina, that was
Mm-hmm.
going to it could cause blindness. So they had to get that down quick. And then the topical eye drops were given 4 times a day. When you pick your drug, you're picking your disease. And I really believe that the combination of all these things, it helped her to avoid to be on an immunosuppressant because they were
Mm-hmm.
really trying to push that at that time. And she opted not to. She wanted to see how this naturopathic regimen would work. And really, by December, she was getting so much improvement. And then, but that they kept slowly decreasing her steroids. You can't stop those steroid eye drops quickly, but it
Mm-hmm.
kept getting lower and lower. And then by March, she was down to just 1 drop a day.
Oh
And then when
wow.
they looked at her at the retina, it was beautiful. It was completely calm and it was healed and her MRI looked good, where the lesion where it was affecting her vision was gone. And so
Mm-hmm.
it was so encouraging. It really helped bring her into remission.
Mm-hmm.
And people, even these topical steroid eye drops, they don't realize that you're also at an increased risk of early cataracts. There's always there's consequences to some of these big meds, and we're trying to avoid that. That's why going to the naturopathic route. There's a time and a place, and I acknowledge that for steroids and for other pharmaceuticals, and especially with autoimmune. There's a time where you got to get that down quickly. But we want to incorporate. I really believe that the best care is integrative care. Combine that with naturopathic therapies to help keep you in remission and keep you healthy, happy. That's the name of the game. It helped with her anxiety or depression, just everything. Her brain fog lifted, her skin was clearer, she's happier, her hair was coming in thicker, everything. She was just thriving. And that's a beautiful thing to see that in our practice. We love that.
Absolutely. I think that really sums up, I think, a lot of kind of the the soul of naturopathic medicine and what kind of draws us in. I think for many of us looking at all the modalities that naturopathic medicine offers and the true kind of integrative approach based on this kind of therapeutic order that helps guide the decision-making process, that acknowledges the importance of these higher force interventions, but within this framework that we use it in a rational way to the level that it needs to be used, and we don't go beyond that as maybe the typical case, but by providing this important kind of foundation, first of all, like you said, dealing with the obstacles to cure and educating patients and empowering them to be their own advocate and their main support dealing with this disease process. And then again, everything from these kind of foundational nutrients, these powerful botanicals, again, homeopathy, this phenomenal modality, and again, being bold enough to use it as we need to. And the fact that you were given like, was I think like 5 times a day, like once a week or something like that. Yeah, just definitely driving home that message to the body of healing. And I think she had talked about, or you mentioned like her visualizing the healing that was taking place. And as she's having this counseling, as she's processing these deep-seated emotions, as she's helping to physically heal her nervous system, there's just now where the body's ability to heal, again, what's considered to be a progressive, debilitating autoimmune disease with no cure that oftentimes requires high force interventions to keep under some level of remission in this conventional landscape. We see when we use a truly integrative approach that even has the space for the use of the pharmaceuticals and homeopathy. They are not by any means necessarily these incompatible modalities, but there's a methodology to using it. And now you can actually support the body in reversing some of that disease progress. It doesn't mean that we've completely removed the disease and it's okay, I'm cured, I never have to take an eye drop again, I never have to supplement, I can eat gluten and dairy all I want. It's like, no, you still have those conditions, those preconditions, but now you have a better awareness of your own body, your own story, and knowing what it takes to support it using these modalities that we have, including homeopathy, and realize, okay, sometimes may need that little bit of Staphysagria to help process this, a little bit of this nat sulph, a little bit of Conium when these symptoms start to come back. So I thought, again, a true testament to the integrative approach of naturopathic medicine, and I think a phenomenal patient case with a happy ending and a lot of good nuggets of wisdom for our docs out there.
Well, thank you. Thank you for having me. People forget, I live in Pittsburgh. At one time, the hospital here in Pittsburgh, it was actually called the Homeopathic Hospital. And really, they would combine surgery with homeopathy. And I've interviewed like other retired nurses, and they can remember when this was a homeopathic hospital. And they still have pictures inside the hospital showing them using homeopathy. And then we got away from it. And you live long enough, what was once considered old becomes new again. Mm-hmm. And my goal is really to help promote like some of the benefits of homeopathy, but also to push for more research in homeopathy. Is I think that will help to keep it. I want to see homeopathy stay in our curriculum, and I want to see it passed down to these other generations and the benefits of. And it's important to continue the research and try to open up the door again for that.
Absolutely. Do you have, I guess, if people want to follow you, I know you said you're working on teaching some course soon. Is there somewhere where anyone can follow you if they want to learn a little bit more, or especially get a little additional training in homeopathy? Any resources you recommend?
Do you know, I have a website called drheidi.net, and I list my talks in the news section, and it'll list all my upcoming talks. And I speak regularly to different conferences and things, and I always mention homeopathy in my talks because it's just a passion of mine. But it's exciting. I'm working with the University of Pittsburgh nursing schools. They're going to be doing a study this fall on homeopathic gelsemium in test anxiety in nursing students.
Oh,
so they're going to do a pilot study in the school in Erie, and if it tests positive, they're hoping to include it in a longitudinal study with all the nursing schools. So there's 7 or 8 in the Pittsburgh area. So that's exciting.
That is, I hope it has positive effects, and if so, that they continue to carry on those studies. Again, I think that we should definitely, as naturopathic doctors, be embracing homeopathy more. Not everyone has to identify as like a homeopath per se. You
Yeah.
don't have to feel like you must practice classical Hahnemannian and homeopathy, though if that's the legacy you want to preserve, it's absolutely within your right latitude. But I think just being open to using it, being not afraid to try a few different remedies, because again, we have such a wide safety profile, and again, it definitely has profound effects. And even if we were to take away from it that everything is mental emotional, have we not seen how central the mental emotional component is to healing in any sort of severe chronic medical case? If we can't address that, that's one of the major obstacles to cure, I think many would argue, especially as we're looking at the latest research in the field of kind of neurosciences and psychoneuroimmunology, and how again the emotional mindset plays a critical role in the body's ability to heal.
Psychoneuroimmunology. I love that word, but it's just a real fancy word for saying, oh, stress affects your immune system.
It The medical field would not be the medical field if it did not have to invent a convoluted language for it to
Great
express
word.
itself to its fellow peers and leave everyone else, okay, what are they talking about? But it's a good opportunity to practice some Greek and Latin while we're at it.
There you go. Dr. Kandil, it's been a pleasure. I really enjoyed our talk.
Absolutely. Same here, Dr. Weinhold. And again, I'd like to thank everyone who's viewing, and again, mention NDNR's continuing education platform for further education. That concludes our Applied Naturopathic Medicine Roundtable for today. Again, I'm Dr. Kareem Kandil, and for complete case studies, clinical protocols, and naturopathic medicine continuing education, please visit ndnr.com. Thank you, and have a wonderful rest of your day.
Thank you.
This has been the Applied Natural Medicine Podcast, a production of NDNR, publishers of the Journal of Applied Natural Medicine since 2005. Access the full archive of case reports and clinical insights at ND. For subscriptions, partnerships, or submissions, contact us at edit